Hey guys, it's Mary Lou with Nursing in Progress. Today I'm going to go over Fundamentals Exam 3, just a quick overview. It's only going to be based on oxygen, nothing else. So here we go. So as you guys can see, this chapter is going to be based on oxygen, this next exam. So we're going to go into a few questions and answers. We're going to talk about the nasal cannula. We're going to talk about respiration rates, and we're going to talk about, of course, oxygen. So let's do a little bit of questions and answers. The nurse is caring for a patient who's experiencing dyspnea. Which position would be most effective if incorporated into the patient's care? So we're going to do head of bed elevated would be the answer, and it would be 80 degrees. So the reason for that would be an upright or elevated position pulls abdominal organs down and lungs are able to expand. Think about it. So when you take a deep breath, you kind of sit upright, right? Like you're not hunching over, you're not doing that. You're taking a deep breath, you're sitting upright. So while a patient is receiving hygiene care, the chest tube becomes disconnected from the water-sealed chest drainage system. Which action should the nurse take immediately? So this is another question, and it's asking action taken immediately if the chamber has air leaks, cracks, or if it disconnects from the system. What is the first thing the nurse is going to do? The nurse is going to place the disconnected end nearest to the patient into a bottle of sterile water. Due to the fact that if something does happen, this is going to be the first thing. Like, it's happening now. The nurse can't do anything else. So that's the first thing she's going to do. And that's what it's saying. So here we go again. Here's some more questions. A client with a pulmonary hypertension and right-sided heart failure has conventional dyspnea and shortness of breath. What is the first action the nurse should take? The nurse should make a quick assessment of the adequacy of breathing, circulation, and oxygenation in order to determine the interventions. So, think about your ABCs and your ADPI. First, she's going to do the ABCs, and that's airway, breathing, circulation. Then she's going to do the assessment, diagnosis, planning, intervention, and that would be the ADPI. And then if anything, and it keeps moving, and that would be probably Maslow's. Alrighty, so here are the questions and answers for these two questions that we went over right now. And let's keep moving. Alrighty, I have more questions. A client with a closed head injury has a respiratory pattern that progressively increases and then decreases in the depth, followed by a period of apnea. And the answer would be Shaney Stokes respirations. And so it's crucial to know your respiratory patterns. If you guys know them, that's perfect. But let's do a little overview. So the ones that I think, you guys should definitely be aware of would be eupnea. Eupnea, I probably might be saying it wrong, but that's normal respiration rate and rhythm. So anything, if there's a question on the exam, which they probably wouldn't because that's too easy, it might say something about normal respiration rate and rhythm, and the answer would be eupnea. And then apnea would be the absence of breathing, maybe a periodic. So apnea is the absence of breathing. Eupnea is normal breathing. And the other one I want to go over is what it was talking about, Shaney Stokes. And that one is basically respirations that gradually become faster and deeper than normal, then slow, and then alternates in the period of apnea. And then apnea, remember we said it's like they stop breathing. So it's going fast, slow, fast, slow. And I'm actually going to have a little bit of presentations in here in regards to how that goes. But I want to talk about hyperventilation, and that's deeper respirations. It's normal, it's just they're having deeper respirations. And then here we go. We have the respiratory patterns here. We have eupnea, tachypnea, bradypnea, apnea, Shane-Stokes. You'll be able to see all of them, which would be biots, shallow, agonial. You'll be able to see how those actually look like. All right, so let's move on. And then here's a little bit of more pictures. It's showing you the bradypnea, the tachypnea, and that's fast. Bradypnea is slow. So you could have like a little picture about it in your head and think about, okay, this is how it looks. This is how it would look. Alrighty, so here are more questions. A patient with COPD is prescribed O2 at 24, FiO2. What is the most appropriate oxygen delivery method for this patient? So it would be a Venturi mask. Venturi mask can deliver 24 to 50% FiO2. COPD would be, anytime there's like a question with COPD, it's probably going to be Venturi mask. And that's the reason for that is because the cone shape adapters allows you to give a specific oxygen delivery. Think about it as bra size. Some people wear bra size A, B, C. Therefore, the adapters are a specific bra size. So with the Venturi mask, it has like little adapters, which I'll show you in a little bit how the pictures look like. And then some of them give you a specific oxygen, 20%. 40%, 60%. It's the same as a bra. Like you're going into, like, example, Victoria's Secret, you have a bra size A 32, A 36. You see that's yours specifically, or you might be a C 36. That's yours specifically. Now with the nasal cannula, it's 24 to 44 FiO2. But it only gives oxygen in liters per minute. So you can actually give a precise FiO2. This is a one-size bra. So the nasal cannula, I see it as a one-size bra. You know, those bras, like sometimes it's mostly like sports bra, which you could basically like wear it, and it, it might fit others better than, somebody else. So it fits everybody. It's just not gonna fit perfectly as to what you want specifically. So that's what I compare it to. Venturi mask is like your specific bra. Nasal cannula is like, it's good, but it's giving out the same, and it's to everyone. So just think of it as one size bra fits all. So rebreather masks are used when high concentration of oxygens are required and saves on a third of a person. This one's really just good to know what it is. Might not be on the test, but the specifics that are going to be on the test is what I mentioned about. Most likely Venturi mask or nasal cannula are the main ones that are generally used, but I just wanted to put that in there so you guys could be aware. And here you would be able to see the Venturi mask adapter. You see how the adapter is? So some of those adapters, they all have a different number once you actually look in there, and you'll be able to see that some give more than others. And as I mentioned before, think of it as a specific bra. That specific bra, your size A 36, size C 34, that's your specific. So if you're pink, green, white, it all has a specific. And here you go again. So 32D, 36D. So you guys could have a clear picture overview about it. And now the nasal cannula is the one size fits all, which obviously you're just going to put in the little nasal cannula on a person. It doesn't have to say specifically, oh, well, this person's going to take this much. It's just going to give you the oxygen, and it's whatever they put it as, and that's what you'll be able to give to that specific patient. But nasal cannula doesn't have a specific size, doesn't have anything special about it. It's just something that goes in your nose, and that's it. So now let's move on to manifestation of hypoxia. So I put a little picture right there of a rat in a pen because that's what I put it as. I imagine a rat in a pen, so hopefully this picture helps out with the rat, and then pen. And how I'm going to tell you guys is, okay, so it's R is for restlessness, A anxiety, T tachypnea, another T for tachycardia, P for pale skin, E for elevated BP, and N for nasal pharynx. And that would be the rat pen mnemonic that I have in there for you guys. Alrighty, so let's go over a few more questions. Which information provides the most reliable data about the effectiveness of airway suctioning? And that would be breath sounds, vital signs, and pulse oximetry before and after suctioning. To acquire data about effectiveness of suctioning, we need to first assess breath sounds, vital signs, and oxygen saturation. If it is the same, the suctioning is effective. Okay, so what is this question really asking? It's asking, how do you know that airway suctioning is working? And the answer was that the breath sounds, vital signs, and pulse oximetry before and after suctioning. So it's asking, how do you know it works? So if you know that the SpO2 was 96 and then you check again after you already did the suctioning and it's 98, then it's working because something is helping out the patient. So you're seeing that there's data there and that you've actually made it better for the patient. So you're helping out the patient. So that's how you know. And that's literally what it's really asking for. It's a simple question, but it just, the wording makes it a little harder to understand sometimes. And that's the thing about these tests. They're meant to trick you. All right, let's move on to the next one. A 60-year-old man with the emphysema does not understand the need to stop smoking at his age because the lung problems already exist. Which would be the best response for a statement? So the nurse is going to say, once you stop smoking, your body will begin to repair some of the damages to the lungs. With that being said, the nurse needs to focus on correcting the patient's misinformation rather than to convince him to stop smoking, because she's just giving him facts. She's not saying, oh, you need to stop doing this, this, and that. Because sometimes the older patient, especially a 62-year-old, is going to be like, okay, why are you telling me to do something? But if you just give facts and they think about it and they're like, well, maybe they are right. Maybe I should stop smoking. Maybe this is, probably going to help me out. So that's literally what the nurse's job is, to just give out facts. And then it's up to the patient to say yes or no. Alrighty, so let's move on to the next page. Monitoring and repositioning. When administering opioids, we need to monitor for adverse effects, which are respiratory depression. Alright, so just think opioids, respiratory depression. Alrighty, let's move on to the next question. When using sterile technique to perform tracheostomy care of a new tracheostomy, which action is correct? And the answer would be placing the patient in semi-Fowler's position if possible. This question is very important to know. There might be a few questions about this, but just remember, semi-Fowler's position, always, especially if the patient already has a trach on them, just know to, place them in that semi-Fowler's position. Because what does it do? It promotes lung expansion and prevents back strain for the nurse. So if the patient is in semi-Fowler's position, it just helps the patient out and it helps you out as well. Okay. Moving on to oxygenation. A client's pulse ox reading is 90%. What action should a nurse take first? And I have A, B, or C. The answer would be C. Move the sensor to another area. All right, let's move on to nursing diagnosis. These are crucial to know your nursing diagnosis. Every chapter, everything is going to be about the nursing diagnosis, so it's always good to know these. So let's talk about ineffective airway clearance. That diagnosis is used for the inability to maintain a certain airway. Example, a patient is coughing and has bilateral bronchi throughout the lung fields. Which nursing diagnosis is the most appropriate for these segment findings? And that would be ineffective airway clearance. Why? Because the patient is having difficulty with their airway. So that one is like easy to kind of understand, but then if you think about it, you're like, okay, let's think about it, because you might confuse it with ineffective breathing pattern. It's easy to confuse these: ineffective airway and ineffective breathing pattern. But the diagnosis ineffective breathing pattern is used to describe inadequate ventilation, such as hypoventilation, hyperventilation, tachypnea, bradypnea. So you see, one has to do with ventilation and the other one has to do with the lung field. Those nursing diagnoses do get people confused. So just try not to confuse yourself with those, which are a little difficult to kind of first understand. But then once you keep doing it over and over again, you'll be like, okay, now I understand what the difference is. Alrighty, so I do have a little extra questions in here. When should a nurse collect sputum? Early in the morning, and remember to encourage the patient to cough. Coughing is more effective than artificial suctioning. And how does oxygen toxicity result? It results from high concentration of oxygen. These are extra questions I got from ATI, so you guys could just be aware of those, because the test might ask a few questions about these little things that you're probably like, oh, I didn't read about that in the book. But yeah, it was on ATI, so just try to know what that means. And if a question does come up, you'll be like, oh, I know, I remember I have to collect the sputum in the morning, due to the fact that that's when it's more basically like it's like fresh, like it's in the morning, you haven't really eaten anything, so that's when they're trying to collect it, and you want a patient to cough the sputum out. And then how does oxygen toxicity result? Obviously, it results because you're giving them way too much oxygen in there. And they're only supposed to have a certain percentage. They're not supposed to be going overboard. Alrighty, so a little extra for you to know. Always post a no smoking or oxygen in use sign to alert others of fire hazard. Why? You guys know oxygen is something that we need to definitely teach the patient about. And we need to have clients wear a cotton gown because it's synthetic. Wool fabrics can generate static electricity when they have oxygen. And then always limit total suctioning time to 5 minutes. Don't give them too much. This is when we're suctioning. This is when we're trying to get all the sputum out and we're doing all the suctioning, because we're also talking about suctioning. It's I'm gonna do it, try to do it 5 minutes, take a little break, and then another 5 minutes, take a little break. We don't want to just keep suctioning and suctioning and suctioning out of the patient, and it's not gonna be nice, it's not gonna be cool as well, and they're not gonna like it. So things to ask yourself: what are some signs and symptoms to assess for hypoxia? And I gave you the rat pen to remember, because hypoxia is a big deal. So that's something that you must know. Just remember the rat pen and you should be good to go. And what position should I place the patient who's already receiving oxygen via nasal cannula? What intervention is the priority? And remember, priority is Fowler's. And know the difference between a Venturi mask and a nasal cannula. And we did talk a little bit about that with the bra size and all that. And once you already are capable of knowing that, just know like your percentages. So with the Venturi mask would be 24 to 44% FiO2, 1 to 6 liters per minute. Venturi mask 24 to 50% FiO2, 4 to 12 liters. Not really know your percentages, but know what it is used for, what kind of patients use what. And then you should be good to go already. Well, I hope this was helpful, guys. And let me know if you guys have any questions. Ask me on Facebook, on Instagram. I'm available. Let me know. You guys have a good one. Good luck on your studying. Bye.